All right, we are back on MorningLine. Clint Kelly, our guest. He's a malpractice attorney. The phone number on the screen in just a moment, you'll see. And give us a call if you have a question about a case, either yourself or someone you know that perhaps did not get a result and they thought something was not quite right with a doctor or a hospital. But when we went to the break, I was talking about there are a lot of documents you're asked as a patient to sign before you go in for some kind of procedure. What were some hospitals doing? An arbitration agreement? Or how do you know? And should you sign it or not?
Yeah, well, first of all, an arbitration agreement is an agreement where you agree not to bring any lawsuits in a court against a hospital for negligent medical care. That's the bottom line. You're giving up your right to a jury trial, giving up your right to be in front of a trial judge, and you're saying, I will have my case litigated before an arbitrator. An arbitrator is just a lawyer, one person who acts as judge, jury, and it's all private. You can't disclose anything from it because they're almost all confidential. And the problem with those is when you have an arbitrator, that's just one person. So if that one person isn't convinced, your case is over. Unlike a jury where you have multiple people, the conscience of the community deciding, arbitrations generally are lower verdicts than jury verdicts when you win. So you don't have to sign them.
How do you know, by the way? I'm just tangibly, it's good. I'm there in the hospital and they're giving me the paperwork to sign. Will you see it? And if you choose not to sign it, can the hospital then refuse to treat you?
They're not going to refuse to treat you.
Okay. So but will you be able to tell what it is? I mean, you know how it is.
Yeah, it'll have on the top,
arbitration.
Agreement to arbitrate. It has to be its own separate document.
Okay.
You have to read through it, sign it. There's a lot of documents you'll sign before surgery, like a surgical consent form.
Yeah.
You know, there may be also a form involving types of medications you have to have, whether they're narcotics and things like that. This will be its own separate document. It'll say arbitration. Do not sign it. Just give it back.
And would you say that across the board? Because I think at one point you mentioned to me that some of the hospitals were pulling away from that because they were losing in arbitration.
That's correct. In fact, you don't see it as much as you used to because they started losing, but people may think, well, gee, then why don't I go to arbitration? Because when you go to arbitration, more often than not, the recovery, the compensation is less than what a jury would give you. If you've got a good case, you want to be in front of a jury.
Okay. Are we still seeing infections in hospitals, folks that go in for procedures that then get MRSA or some of these other infections? They used to talk about how it was such a big problem and whether or not that's an actionable offense. That happens a lot. Maybe it's gotten better now. And you're right. It was a black hole when the hospital shut down during COVID. No one could go in. You just didn't know what was going on. What do you think?
I think the infection rates of patients has stayed relatively the same post-pandemic as it was pre-pandemic. The fact is, Nick, infectious diseases are an endemic part of the hospital experience. There's only so much you can eliminate. There's only so much that you can prevent. I'm not saying that if you get infected, you've got no ability to get compensation if there's wrongdoing, but the vast majority of the time, the infections are simply a part of the procedure that, I don't say it can't be prevented, but it's very difficult to prevent. Where these cases arise is when the infection is not diagnosed promptly and dealt with properly. And someone, like I've had a case before where a person developed a post-operative infection, had their leg amputated above the knee. Completely preventable. If the infection simply been diagnosed and treated with antibiotics, this man would have his leg. But it wasn't. It was just sloppy surgical care in an outpatient clinic. That's the type of situation where you'll have a lawsuit.
Okay. I'm just curious, I was thinking right now as I was listening to you, but have there been any high profile or other cases, maybe some of which you've handled of late, and you and I have done stories on several fascinating cases over the years, some that are still pending, that come to mind that you could share? I know there were some with these men's clinics.
Yeah.
They have issues, right? Perhaps.
They do. Some of these men's clinics had a bad pedigree. They weren't educating their patients about the risks of the type of procedures they do. One of the procedures involves taking what looks like a diabetic needle, putting a compound, a solution in there, and injecting it directly into the penis, which would force an erection. The problem with that is there's a risk that the erection may last 10 hours, 12 hours, 24 hours, which can be not only damaging to your ability to have sexual relations, but it can also cause damage urologically where you could lose the use of your penis. Patients weren't being educated. A lot of this was kind of wild, wild west medicine, and I had a couple of cases that I was able to get my clients compensated because they were rendered impotent, and it was like snake oil kind of medicine. And people that go to these clinics, just make sure you ask lots of questions and make sure you know what you're doing.
Yeah, some of them are nomadic, the clinics. They come to a town or whatever, they're here for a period of time, and then they move on to other states. Especially because records don't always follow from state to state, do they? If you're checking on a doctor or a malpractice, I mean, that was my next question. If you're trying to find a new physician or a doctor, how can you check on them to see if they have a history of dealing with people like you, if you know what I mean?
Yeah, as a matter of fact, I think I did a story with Hannah on the news a few months ago about this. At least with physicians, you can go to the licensure website of the Department of Health, and you can scroll down under the physician's name. When you type their name in, they'll bring up a profile and tell you where that physician went to medical school, their residency training, and you can scroll down to the bottom of the webpage and it'll tell you where they've paid out any settlements. Now, that doesn't tell you necessarily whether they were involved in a case that created a settlement, because if their practice paid the settlement, like the clinic, it won't be reported. The answer to your question is there's not a whole lot you can do other than you see the social media, the Google approval, 1 star, 2 star, 5 stars. That does give you some idea, but doctors and hospitals in particular, are really good at covering up their tracks when they've got a problem in their ranks with someone who's harming patients on a regular basis. And if a doctor gets really bad at it, he'll just cross state lines and go somewhere else.
Right. And you don't know about it, and they just pass the problem on to someone else into another state.
Yeah.
Pharmacies, you deal with pharmacies sometimes?
I do, sometimes.
Okay, like meds that perhaps, I remember you once brought in a book that has all the pills in there. And it's good to look at the pills, but you've had some cases that we've done stories on where people got the wrong pills, and if not for maybe an alert family member noticing it wasn't quite the same shape as a pill that they used to get, gosh knows.
And I had a case against one of the major pharmacy chains here where they dispensed the wrong medication, and it was a generic, and you could not tell the difference between that generic and any other pill that they were taking. Because see, when you get generics of a brand name, you don't know what that generic's going to look like. Sometimes you can take like an Ambien and it looks round, and then the generic form looks like a torpedo. Yeah. Well, in this case, it's just different shapes and colors.
Yeah.
We trust our pharmacies to prescribe the right pills. I mean, it just is what it is.
Right.
You look at it and you think, okay, this is the generic form of the pill, and you take it, and then bam, you wind up in the emergency room and say, what the heck just happened to me? And then you find out after the fact that it was the wrong pill. In fact, what I tell people is if something like that happens, save the pills. Don't do anything with them, or take a picture or whatever, at least so you can substantiate what happened, and then you can go to the pharmacy, or I can go to the pharmacy if I sue them, and find out how it happened. But this type of thing happens more often than you think, because pharmacies now are kind of like hospitals. They're assembly line.
Yeah, they're so busy and it moves so fast. So when you go and get a prescription, what do you do?
Well, I look at the pills as well, but I'll be completely honest with you, Nick. When I open up a pill bottle and I see what looks like a generic, I take it. I just...
Okay, like most people, okay? So you trust it, and the vast majority of the time, they're right on it. But it's scary, especially depending on the nature of the medicine, and I've got, is that the whole idea behind the different sizes and shapes of pills to differentiate? Is that the purpose of it?
Well, I'm not sure why they make them different sizes and shapes. What I do know is, on many occasions, my health insurer prefers that I get generics.
Okay.
And so
because they're more affordable, right?
Yes, exactly. And so I open up the pill bottle and I take the pill, and I just assume that is the generic, and I'm right, 100% of the time, knock on wood, I haven't gotten a bad one. I think it's unfair to expect consumers to start looking up in the physician's desk reference to see whether their pill is the right type of... If we did that, Nick, I wouldn't have time to cook dinner at night. You know what I mean?
Almost talking to you made me want to get one of those books and do that, because the potential, if it goes wrong, it can be pretty bad. Yeah. That's the thing that kind of scares you. You think about stuff like that.
I'm probably a little lackadaisical on that, and I should be, because I know I've had 2 cases now in the last 5 years. One of the ladies just went to the emergency room and she recovered. Another lady had to have hospitalization for an entire week and had to have about a year's worth of post-hospital care to get her situated, because she had an epileptic attack from getting the wrong drugs. Yeah.
The other thing is, if need to be hospitalized, we'll call Clint. Now, without naming names, are there hospitals, say in Middle Tennessee, you would not want to go to?
Yeah.
I mean, for sure. Based on what you see, you say, no, I'm not going there?
Yeah, there's some that I won't go to, and I won't allow my family members to go to. There's a couple here that I would go to.
Oh, yeah. I mean,
I have confidence in. But, yeah, there's some hospitals in Middle Tennessee I wouldn't let my dog go to.
Based on what?
Based on my experience of dealing with them, based on cases that have come from that place, and more importantly, because of the type of healthcare providers that facility tends to hire. You can just tell when you're around them and you question them and you begin asking about protocols and whether they adhere to the protocols or violate the protocols. You can say this place is not suitable for the type of care I want. By the way, Nick, you talk to doctors, they'll tell you the same thing. They know.
They do.
Sure. They know exactly which hospitals to avoid and which ones to go to.
And it's because
for their health care.
And is it all based on cost? I mean, some of these hospitals that are hiring what they are, they're not getting they're not paying enough to get the top flight individuals, or what?
That's part of it. Another part of it is management. What type of management does the hospital have? Whether the director of nursing is aggressive and makes sure that protocols are adhered to, or whether you get a kind of a Wild Wild West hospital where just about anything goes. One thing I think that's changed here that could be a change for the better.
Okay.
Vanderbilt bought the hospital in Lebanon, which used to be University Medical Center. Mm-hmm. I believe they bought a hospital in Tullahoma, I think. But anyway, you're seeing the hospital chains reach out and grab hospitals and bring them into the chain, which causes the result is a more uniform standard in the type of care they provide, and that could well be an improvement in healthcare. That's what I'm hoping, at least, because when you got Vanderbilt coming in, they bring
their set standards.
Yes, and their folks. You know, they bring the heavyweights over to make sure that hospitals run the way they think it should be run, and I think that's a difference from some of these smaller hospital chains that are much more cost conscious, and I think the smaller chains tend to break the rules more so than the bigger ones.
Take a break on that note when we come back. Final segment with Clint Kelly right after this. Stay with us.